Thank you so much for such a warm introduction, and thank you to the board, to the faculty, and to the administration for allowing me to be here today, and especially to you, the graduates, and your loved ones for allowing me to be a part of this special celebration. Whenever I stand at the podium, I am reminded that I've always been a very nervous speaker. And in my very early years, I used to practice with my aunts and uncles and other relatives that became victims, and received some of the best speaking advice ever from my father's eldest brother, my Uncle Big Daddy. He said to me, "Sugar, if you can, be profound. If you can't, be provocative. And if you can't be neither one, be brief." So I'm sure that some of you came expecting profound, and some of you may be seeking provocative. I assure all of you are hoping I'll be brief. And I will be, because I really only want to get 3 things done with you today. I want to congratulate you, I want to caution you, and I want to call you to action. So the congratulations are easy, and I'm absolutely privileged to be here with you. You are experiencing this today, a day of achievement and passage, scary and fun. And I hope that you'll close your eyes for just a minute today and realize where you are and how magnificent this all is. I also want to congratulate some people who are not here, the founders, the alumni, and supporters of this institution. It was their vision and their sacrifice that has made this possible for you. And you have a great opportunity, not to pay them back, but to build on their legacy by building yours. This is an important time for you, and the opportunities are absolutely there. You all have the opportunity to pull people behind you to show that you can be as strong as they have been in providing a platform for future learning and growth, and you have an opportunity to meet your pledge to serve people around the world. Many of you are beginning, some of you are continuing your lives in the life sciences. And whether you're at the science of science end or the business of science end or anywhere on that continuum, we welcome you because we need you. Good leadership is never in oversupply. And we need you if we're going to realize the most basic of human desires, and that is to ensure that we have a world of people who are healthy and long-lived. You are empowered to deliver just that. And I think you learned here from what I've heard today, both at the podium and at breakfast, that you learned here at KGI that a life in the life sciences is not a simple calling. It is not a casual calling. It is deep and it's real. And the work that we do is too important and too challenging for us to not take it absolutely seriously. We all know, all of us in healthcare, that we can all do better when it comes to bettering health. This is a calling of passion, and I have to say that the passion is palpable on the stage, in the audience, everywhere I've been this morning. It's been inspiring. And many of you, I heard, have come into the health sciences of late, and some of you had early dreams and had visioned in being this lifelong. That was me. I have wanted to be a doctor since I was 6 years old. I was inspired by the medical care that was received by another one of my father's brother. There were 16 altogether of that crew. I know. But he came to live with us when I was born. He was a paraplegic at the hands of a severe polio infection when he was 6 years old. I was mesmerized by the medical treatment that he received, from his surgeons to his brace makers. I wanted to do that. And if I wasn't hooked then, I was hooked by our community doctor, Dr. Settles. He served our striving neighborhood with patience and with compassion. He served us with wisdom and commitment. Oh yeah, I really wanted to do that. But even now today, I pause and look back at this. A young black girl in the 1960s raising her hand to say that she wanted to be a physician. It was not a trivial feat. But I had parents that believed I could fly. And they sacrificed and sacrificed to give me wings. And so the third group I want to congratulate today is you, the parents, the grandparents, the significant others and spouses, the children, the family members, the friends, all of you who have given love and support in every single way imaginable. I want to congratulate you on this day of your great accomplishment and great pride. So, I think of my parents all the time, as you might imagine, for all that they've done and all that they continue to do. And I'm forever grateful to them, just as you are to your families. But I also think about them in the context of health and health care. My parents had very different health outcomes. I have a father who is 94. He'll be 95 in a few short months. He can run rings about half the folks in here this very day. He is very much a character. Just a generation or so out of slavery, pulled up out of poverty, a life well lived. He had the opportunity at around his 94th birthday to meet the first black president of the United States. What an amazing experience. What an incredible life for him. My mother died the summer of my freshman year of medical school, struck down at the prime of her life by a stroke. She too was proud. She too had amazing life experiences. She too was focused and determined and sassy, but gone far too soon. Her death nearly derailed my medical career. I couldn't figure out how I was going to manage what had just happened. I couldn't imagine that I had the strength to pursue. But one of my professors, whose stand was simply this, equanimity under duress, asked me a simple question one day: what would your mother want? What would she do? Before I knew it, there I was, sitting in a cap and gown, just like you are, graduating from medical school, prepped to do what I'd hoped would be important work over the course of my life. So I think of them often. I think about their health consequences. I think of the contrast between them, and it makes me wonder about the healthcare system that we are in. I reflect on the progress that we've made, on the progress that we will make, that we know we're going to make. But I often reflect on the progress that we have not made, those missed opportunities in healthcare. And in that, I want to give you the caution. The caution is simply this: do not let the unfinished business of healthcare remain unfinished in your hands. Simply that. And there are three things I'm hoping that you are able to do. The first is to really pull through to full impact the work that you do. The second is to think big picture, to see it all, and to have grand aspirations. And last but not least is to disrupt our notion of disruptive thinking in healthcare. Let me talk just briefly about those three things. The first, I want to tell you a story about a man that I met. He changed me in a moment. Dr. Abdul Kalam, the former president of India. Woohoo! Amazing. It was amazing. He told us a story. He said that in the work that he had done in rocketry, he had been asked a question one day by some students. Someone asked him, "What has brought you bliss, sir?" He said, "Well, let me tell you about something that brought me happiness. We had trouble getting a rocket off the ground. Lots of thrust, as much as we could get, but failed attempt after failed attempt. The team took another tact. I was so proud. They decided, let's leave thrust aside. Let's tackle the weight of the rocket by developing new lightweight materials. And they won. The rocket took off. He said, I told you, though, that brought me happiness. Here was my moment of bliss. When approached by an orthopedic surgeon, I was provided with a challenge, he said, that many babies who get new joints don't have the musculature to lift them. Can you do something about that, he was asked. And they worked with that lightweight material that had solved his problem in rocketry, and there it was, new, lightweight replacement joints so that babies could run and play and live. That, he said, has brought me bliss. So in that first caution, don't stop at the achievement, at the innovation. Celebrate it, yes, but don't stop. Go for the bliss of the full impact of the work that you do. The second is to make sure that you take the opportunity to move those things along. And we know that stuff's gonna come. I mean, we can do robotic surgery from far away, and there are 3D printers standing ready to print new organs. There are people who are paralyzed that are now renewed with regenerated nerves and motorized exoskeletons. We're going to get there. But here becomes the question. We have the opportunity now, right now, to make more medical progress over the next 3 decades than we have made in the previous 3 millennia. I have an aunt who used to always ask me this question: so what you gonna do with that? What you gonna do with that? Behind the headlines for biomedical breakthroughs is a much deeper question. How much medical progress do we really need? How much, frankly, can we really handle? How much can we pay for? We hear this over and over and over again. To many, the answer is obvious: as much as we can get. And ask anybody that's caregiving to a loved one with Alzheimer's, or who's dealing with mental illness, who is watching a child suffer with a rare disease, and they will tell you as much as we can get, and it isn't coming fast enough. So in a sense, society is already banking on the big medical breakthroughs. We already believe that medical science is going to pull us back from the precipice that we'll be pushed to by the largest age wave in the history of mankind, that's putting us all, or will put us all, right in the crosshairs of Alzheimer's and heart disease and cancer. So we're banking on our ability to make a difference in those spaces. Because the alternative is, frankly, just too frightening to contemplate. A system where people continue to suffer and die needlessly against a system that is bankrupt and unable to take care of them. So we know that we're going to get there, and you all will be a part of that solution. We're betting our bodies and our minds on your capabilities. I want to remind you a little bit about what's at stake here. By 2020, the healthcare costs may consume 25% of the GNP, more than education, national security, environmental protection, and infrastructure repair combined. And that's before the age wave strikes the shore. So don't let your innovation stop. Pull them to full impact. The second, see the big picture in the grand scale. How do we know what the real value of the innovation that we work on is? Well, I'm a realist. I know that our healthcare system isn't given all that it can give, and we're not getting all of it, all out of it that we deserve. There's a lot we can do right now, and you've learned much of that, to bring more value and more efficiency to the system, more health to more people. But we have to take a giant step back, I think, and remember ultimately what your work will bring. That investment in healthcare is going to buy us a world of more brain power and more capacity. It will unleash a wave of global creativity. I challenge all of you to think on that grander scale and to think about the value that you bring against the bigger picture, because the best of all the value might be simply this: The biggest chance to change the world may come by you giving billions of other people a chance to do the same. And a recent analysis illuminates this in an important way. The ripple effect is profound. Just 10% decrease in the death rates of Americans from heart disease and cancer, those two things alone, would deliver $10 trillion into the national coffers. It's a huge down payment on the national debt, financed by a relatively modest reduction in mortality from two, frankly, preventable categories of disease. So back to my aunt. What you gonna do about that? The third caution is don't allow yourself to be trapped in silos of what we think disruptive thinking is. Disrupt disruptive thinking in healthcare. Let me explain. Many people think that disruptive thinking comes with technology, your iPhone, that changed the course of landlines and home phones and CD cabinets and cameras. But it's not likely that healthcare will be changed with a single silver bullet. It won't be changed overnight or by the next morning by a single finding. It is going to be changed by real disruptive thinking to help us turn a system on its head that thinks it's as exciting to do things that we used to think were mundane, like deliver to people the value of what we already have. So much is left on the table. Let me share this brief caution. Consider that half of all adults age 50 will have chronic diseases. What if we thought in terms of prevention and wellness? What if we decided to take some of the halfway progress that we have in the treatment and management of chronic diseases and the prevention of those things and actually put our shoulder into it? Because here's some examples of the halfway mark. 60 years after the first approved medicines for hypertension, high blood pressure remains an epidemic and arguably to some a neglected disease. 50 years after the Surgeon General linked smoking to cancer, cigarettes continue to kill 500,000 people a year. 40 years after the first statin was isolated, 60% of Americans with high cholesterol don't have it controlled. 30 years since HIV was first characterized, 330,000 people a year who are infected. 20 years after the advent of highly effective antipsychotics, so many people remain untreated. And more than 10 years since the development of the Millennium Development Goals, we haven't made but baby steps in trying to reduce the horrible maternal mortality that plagues us around the world. I heard a statistic the other day that gave me chills. Disruptive thinking, I thought after I heard this line. 1 million children a year die on the day of their birth. 1 million children die a year on the day of their birth. What if disruptive thinking is doing the simple things we know could get them to day 2? The cautions. So what are you going to do about that? Here's the call to action. Bring disruptive thinking to each and every dimension of healthcare, not only to biomedical breakthroughs, but also to the less obvious areas of opportunity and need: prevention, wellness, nutrition, early diagnosis, healthcare access, health-related insurance and finance, and certainly public health. All of these are beckoning to you. We've got a lot to do. We need to uproot and streamline a linear industrial drug development process that takes a full generation in many cases. We need to change that process to one that is collaborative and circular, and one that cherishes ideas from all sources. We need to get much more serious about healthcare disparities. We have to end the day that your zip code can determine your health outcome. We need a healthcare finance system that's as advanced as the breakthroughs it's designed to encourage. We need new thinking on risk versus benefit, cost versus value, rare versus chronic diseases. We need to disrupt each and every part of it, and that will take you and your collaborative action. What struck me this morning was that you all worked together, that KGI was inherently an organization that was a bridge builder, a silo destroyer. It gave you access and ability to think about each other, to know each other, and to look forward to work with each other to bring these things down. You have all grown up with global connectivity. You're comfortable working across boundaries. You've seen the power of disruptive thinking and have heard an admonition about disrupting disruptive thinking. You're all ready to lead and to collaborate. That's the kind of thinking you have to bring, and I think it is attainable and just in front of you. So, if you think about today, I'll say this last bit to you. Your legacy starts today. That word, legacy, was one that my parents spoke to me when I was first a teenager, at least the first they spoke it, and I really understood what they meant. I was obsessed once they told me that I should build one and asked what it would look like. And they told me simply this: your legacy will be measured by three things: what you leave behind, who you bring behind, and what you've learned along the way. So as we move to this inflection point, let me ask that you seek to leave these things behind: a healthcare system that offers hope, dignity, and access to billions and billions more of people around the world. You can bring behind a new generation of life sciences innovators, just as yourselves, focused on disruptive thinking and transformational change. And along the way, you'll learn that your biggest contribution to the world will be giving more opportunity to people to change it. It's a noble challenge, and it's one that I hope becomes not your life's job, but your life's work. Roll up your sleeves, lean into it. We are all depending on you. Do not let us down. Thank you, and congratulations to you all.